Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
And today we'll talk about the recent measles outbreaks in the news and kind of get into where's the public and public health. So let's dive in.
So measles, I thought that was eradicated. I got my vaccines many years ago, I believe, as did everyone in my family. So what's going on?
Yeah, what is going on? Same. Got my vaccines when I was itty bitty baby, but it seems like it's popping up in the news. So a few states. First, we saw the Virginia Department of Health put out a news release over this past weekend saying that they're aware of a person with a confirmed case of measles who recently traveled through Northern Virginia after being overseas.
Yeah.
So this exposure was linked to international arrivals at Dulles Airport and then also at Ronald Reagan Washington International Airport. And these were both on January 3 and 4.
And then there were cases in New Jersey, in Camden County, and in Philadelphia, a measles outbreak that has so far infected 8 people. And at the end of last year in Delaware, around 20 to 30 people. So that's a dangerous corridor there from New Jersey down to Virginia, I suppose. So let's talk about who is at risk with measles.
Yeah. So, if you're exposed, you're at risk of developing symptoms. And health officials say that if you do develop symptoms, you should isolate immediately. And what are those symptoms? They usually appear within 1 to 2 weeks. And they include, your typical things like fever, cough, runny nose, also a rash, red watery eyes, or pink eye. But really, who's at risk is anyone who's not gotten the vaccine or not already gotten measles.
So we're good, right?
Yeah, you shouldn't worry. Actually, according to the CDC, 1 dose of the measles vaccine is 93% effective at preventing it.
Excellent. I've had 2 doses. So what's that?
97%.
Excellent.
Looks like we're hopefully in the clear.
Yeah. Still, it's definitely like a head scratcher. There's no need to worry or anything by any means, but it's just the idea that another disease that was essentially eradicated is making a comeback, if you will. And I think it's important to note that children under the age of 12 months are at risk because they have not gotten 1 dose yet. And that is scary for 2 reasons. Number one of these exposures, I think it was the one in New Jersey, I may be wrong, took place at a daycare center. And I think the one in Philadelphia took place at a children's hospital where they're necessarily children under the age of 12.
A few years ago, there was an outbreak in New York. I remember when I was in college, there was a case in Boston, and we got an email from our university saying that there was a confirmed case. And I definitely felt so nervous being immunocompromised and all, but it never turned into anything big. And I guess we can attribute that to the successful vaccine campaign for the measles, but things are looking like a little different today when it comes to vaccinations.
Also, I think measles is one of the most highly contagious viruses in the world.
It is. It's spread through respiratory droplets. The thing that's so, I guess, intense about it is that it can be airborne for up to 2 hours after someone with measles has been in the area.
That's a long time.
Yeah. Which explains why that case in the airport was so concerning, because think about how many people could be exposed.
Right.
That's living in the 2 airports for 2 hours afterwards.
Right. So what's the deal with measles? Let's talk about a little bit about the history of measles.
Go for it.
I know that 1912 was the first year we began reporting on measles. It became a nationally notifiable disease in the United States, requiring the U.S. healthcare providers and laboratories to report all diagnosed cases. And in the first decade of reporting, according to the CDC, an average of 6,000 measles-related deaths were reported each year. I think there tends to be this idea that the measles is it's just a rash or some spots on your skin. But no, when you contract it, it's pretty bad. It causes death.
Yeah, and in the decade before the vaccine, it's estimated that 3 to 4 million people each year in the United States were infected. And just a little deeper into those numbers, among reported cases in each year, an estimated 400 to 500 people died. 48,000 were hospitalized and 1,000 suffered encephalitis, which is swelling of the brain, all from measles. So, that's a pretty big impact on society when you think about it.
Yeah, absolutely. We got the vaccine in 1963, then an improved vaccine actually came out in 1968, which set us on a new goal, which was to eradicate measles.
Yeah, so in 1978, I guess 10 years after that improved vaccine, the CDC saw how successful it was and they set a goal to eliminate measles from the United States by 1982. Obviously, this goal was not met,
hmm
but widespread use of the vaccine significantly reduced the disease rates.
Right. So, sort of cutting to the chase, in 1989, there was a little bit of a measles outbreak amongst vaccine age school children, which prompted the Advisory Committee on Immunization Practices and the American Academy of Pediatrics to recommend a second dose of the vaccine for all children. Cases then continued to decline further, and drumroll, there you go. Measles was declared eliminated from the United States in the year 2000, and it was all thanks to an effective vaccine program. There you go.
I will say our listeners can't see, but Mac was wagging his tail when we did the drum roll. He wanted to add in.
There you go. Boom. So measles was declared eliminated 24 years ago, and yet here it is
And yet here it is. Yeah, why are we talking about it today if it was eliminated
from the United States.
from the United States? Well, yeah, that kind of leads us into how we're talking about it. So, despite the successful campaign in the US, measles is still prevalent in other parts of the world. So, if you're not vaccinated and you travel, you can get it and bring it here.
Yeah. So a few things. Number one, like you said, people can travel and bring it here. Of course, generally speaking, the overwhelming majority of Americans are vaccinated against it, and it's an effective vaccine, so it's going to be hard to spread it that way. But one thing that has dropped recently are vaccine rates of school children. So for 10 years, the share of kindergartners who had received 2 doses of the MMR vaccine was 95%. But that rate started to fall and has been continuing to fall, while the people claiming vaccine exemptions for their children has risen as well over the past few years.
Well, before we get to the third point here, just thinking about why are people not vaccinated. Number one, just kind of simple, like families got off schedule with childhood vaccination and COVID.
Very fair.
You know, we were in lockdown, you weren't going to the doctor, and then
Totally.
life gets busy and you forget about it. Of course, health should not be something you forget, it should be a priority, but it happens and that contributes.
Yes, but
Go with the but.
you're still required to get your MMR vaccine if you want to attend public schools in the United States.
That was a good bet. And then vaccine hesitancy is increasing, and parents are opting their children out of getting vaccines at a high rate.
Right. It's been given more permission, to put it simply, to get an exemption to vaccines. And there's certainly more folks looking for exemptions to vaccines. Ironic, considering that it was a vaccine that helped get us out of a major pandemic and reduce a global health crisis into merely a global health pain in the ass, or whatever it is, stage we're in. But even with that great success of the COVID vaccine, the irony is that the uptake in folks being vaccine hesitant has risen.
Yeah, and it feels like a lot of that is connected to, we talked about this, I don't know, maybe a year ago or more, just like how the trust in public health is broken.
Yeah.
And especially since COVID, I would say, from my perspective, a lot of that has to do with the messages in COVID weren't perfect and was changing. Experts were learning at the same time as we were, and that
Right.
contributed to people losing trust in public health authority.
Right. It's like people were unhappy that, like, when the house was on fire, the instructions were not like to the letter perfect every single time. And by the way, it was like a fire that no one had ever seen before, that no one had ever understood, and people were learning on the fly how to deal with it.
And the fire's like changing, you know, like
Right.
the mutations, the variants.
Right. Our metaphor is somewhat butchered, but the point remains. Look, let's face facts. Living in the post-emergency era of COVID, people have come out and are clearly, it was a tough few years. 2020 was it was horrible. It was an awful year. 2021 wasn't much better, and so on and so forth. And there's definitely a level of anger and resentment. I think it's a natural impulse to try and blame someone for that anger. And oftentimes when you're angry, you look to someone to blame, and there's not always somebody that's at fault per se. So the folks that seem to be taking in certain quarters, some of the incoming for this are public health officials who may have gotten some of the messaging wrong, or who didn't adequately predict something that was essentially unpredictable, or the public face, if you will, like someone like Dr. Fauci, who was a public face
Yeah.
of protecting the public at large, and it makes it difficult to convince others of public health concepts generally.
Yeah, I want to go to that point of like it makes it hard to talk about public health. Like a lot of public health successes are sort of invisible. Like when you think about
Right.
like measles before this, like you're not seeing it spread around, so you're not thinking of it as a big threat. Even thinking about like clean water and garbage in the streets. Public health was instrumental in like
Right.
cleaning up our cities, and you don't see people smoking indoors. Like great public health successes you just don't see, so it's hard to grasp how important and like the change that they've made.
If you're a generation or two generations or three generations removed from a certain illness and you don't see the impact, I guess also that's a natural thing not to understand how bad that particular virus was or illness was. I've seen people on YouTube rant about polio, the polio vaccine, and they're saying how it's not so great. And look, it's before my time, but I've read my books and I understand what it was like. And I've spoken to my dad who got his first polio vaccine, I think roughly at the age of 10. And he would talk about how there would be outbreaks at the local public's pool.
Yeah.
Friends of his contracted polio when they were 7, 8 years old. And to this day, they're still paralyzed from the waist down, etc. I mean, it was a really debilitating illness, something that every community saw. And when the vaccine came out, that generation certainly understood what it was, and probably the generation after that as well. But if you're so far removed from it, that concept is so far away from you. It's probably similar to measles with certain individuals and whatnot.
For sure. And I have the same thing with my mom. She always talked about the girl in my class that had polio. And I'm just thinking, we're even one removed from it. And we kind of get it a little bit, but we never really saw it as a threat. And
Right.
do you talk about that with your kids? Like, do you think your kids know about polio?
Well, yeah, because of who I am. I had like the little board books of Dr. Jonas Salk, you know what I mean?
There's bias there.
So let's be fair. Actually, fun fact, I like bragging that I live down the block from where Jonas Salk grew up, and I make sure my kids know that. The other thing, too, is the idea of individualism versus public health.
Hmm.
The idea of public health being something we're trying to do this to protect the public health. Because on an individual level, if you or I don't get the polio vaccine, the odds of us contracting polio are like nil. The odds of us contracting polio and then spreading it are like nil, right? So it begs the question, well, what if there's some side effect that's not known? Bad example, because there is no side effect. The polio vaccine has been around for decades and et cetera, et cetera. And we're using the Sabin vaccine now, which I don't want to get into the difference between the Sabin and the Salk vaccine, but whatever. But why do it? Because as seen with the measles example, if we don't all continue to get vaccinated, it can come back. And we don't want it to ever come back.
Exactly. Public health is the idea of setting up our society for the common good. Like we have a responsibility towards each other to build a society that has conditions that allows for people to be healthy. And of course, there's individual health choices and decisions within that. But the way that public health works enables you to make those decisions. Like I even think about when I talk to my doctor about eating healthy foods, I'm only able to do that because there's public health people that said people need access to fresh groceries and you need to have that in the area.
I guess everyone has individual rights to do what you want, live your life to the way you want. But you don't have a right to live your life the way you want when it is impeding someone else's rights. You know, an easy example in the public health realm is, well, first and foremost, there are rules that we implore upon all of society because we have decided as society that your individual rights are trumped by the rights of society. For example, you have to wear a seatbelt, I believe, in all 50 states, and your individual right not to do that has been taken away. I believe all 50 states, if not the majority, require you to wear a helmet when riding a motorcycle because your individual right to do as you please and potentially put your life at risk is outweighed by the harm to society of you having an accident and having to deal with society, having to deal with the fallout from something of that nature. In a very simple public health example, I think about the workplace. I know of people in workplace settings that go to work even when they know they are knowingly ill. In fact, years ago, not that long ago, it was considered a badge of honor almost to go to work when you still had a cold, if not worse. Like, yeah, I'm sick, but whatever. I'm tough. I'm going to tough it out. But even in a post-COVID world, people are still doing that, where the idea should be, no, if you don't have to be at work, if you're not being paid by the hour and you can be in a setting where you can stay at home and call in for a sick day, that's important to your coworkers and the people around you as well.
Absolutely. And I feel like I say this all the time, but when you're immunocompromised, like a cold just isn't a cold. It's like it gets so much more intense. If I'm around someone that has a cold, I have Crohn's and arthritis, and like it goes straight to my gut and joints. Everything flares up. It's terrible. And it makes a minor cold so scary because your body is falling apart before your eyes. And yeah, like just taking the extra step of people to be careful and stay home and, just not put everyone at risk. It's huge. I don't think people understand. First of all, like looking at me, you don't know that I'm immunocompromised, and people just also don't understand like how much your sniffly nose can get me sick.
Or you could live with someone that's immunocompromised.
Yeah.
Anyway.
Anyways, where do we go from here?
Yes. Where do we go from here? I think it's incumbent upon all of us to better educate folks on public health and the seriousness of public health threats.
Yeah, even just like today's example with the measles, like it was eliminated because of such a successful vaccine campaign. Like first they eliminated cases by 80% and then even more. We know education and campaigns like that work.
Absolutely. And I think on the individual level, I'm not very good at PR, so I don't know how to do it en masse, but certainly on the individual level, talking to folks about vaccine safety, misinformation, combating it on a one-on-one basis, and supporting legislation that requires vaccines and that minimizes the opportunity for opt-outs, for example, to keep the entire public health well.
Yeah, we do a lot of work with our 50-state network on supporting vaccine legislation, and sometimes it could feel like there's a really loud minority there of people who are shouting that vaccines are bad, but there's a lot of good work being done at the state level that you can support.
Absolutely. Well, this was a good discussion.
Yeah.
I feel better than I did when I started.
Well, talking about feeling better, like what's one thing you learned today or in preparation for today that's helping you feel better?
I learned that measles is not dead, but I'm still not worried about it, at least on an individual level, if you will, to go back to that word.
Yeah. And for me, it was just like a really good conversation on the importance of public health and going through the history of things, just even, breaking down with you the history of measles and how we got to where we are today just helps me realize that we have the tools to combat it.
Yeah, well, we hope that you learned something too. And before we go, we definitely want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
And if you have any questions, comments, episode topics, definitely email us at podcast@ghlf.org. Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review on Apple Podcasts, tell us how great we are, and hit that subscribe button. I'm Zoe Rothblatt.
I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.